Welcome to everyone for joining us this evening. It is such a pleasure to have everybody come out today. We're not really, we're not leaving our houses, are we? But welcome to the first virtual MLK Day event hosted by the Affirmative Action and Outreach Committee. For those who don't know me, my name's at the bottom right there, but it's Matt Goldstein. This is my first year as Affirmative Action and Outreach Chair. And one of the many facets of our lovely committee is such things like community service. And usually, courtesy of Melissa and all the hard work she has done, we were sort of going to do an event that she had done in years past, but obviously we were unable to because of COVID-19. So we are here today to have our lovely speakers join our lovely panel and administrator and newly elected sheriff, I might add. And so I'm going to let Melissa go into more details about who's joining us this evening, as again, she did most of the work. I'm just saying in a few kind words. If you are joining us as a first time event guest for the Quincy Dems, not to shamelessly plug who we are, but we do meet every second Tuesday of the month. And again, part of my job is to reach out to people and have them join us. So if Melissa wants to, she could put my email in the chat for everyone to see, and feel free to reach out to me if you have any questions about any more events that we will be setting up. And the last thing I'll say is in honor of today, obviously today honors a great man. And, you know, I could throw one of his many quotes that I've seen posted on Facebook today. But the thing that actually stood out to me the most was the one of him holding a sign that says, "Don't repost my quotes, go live them." And it's these are very interesting times, and we have the chance to make some good history. So I'm all excited about getting behind causes just like the one we'll be hearing about tonight. So without further ado, I'm going to hand it back to Melissa, who is going to politely and much better than I'm doing right now, introduce everybody who will be speaking tonight. So thank you everyone for your time, and Melissa, go for it.
Hi everyone. So I'm going to be doing just a little quick introduction for what we're doing tonight before handing it over to our true moderator, Sheriff Pat McDermott. So as Matt mentioned, for our Affirmative Action and Outreach Committee we have a program where we do days of service throughout the year, and this will be our third year of this program. And so for Martin Luther King Day, each year in the past 2 years that we've done that, we've fundraised and made bagged lunches for Father Bill's, the shelter in Quincy, and it's been a great success year on year, and we did it last year right before COVID came into play. So we had really high expectations for what we were going to do this year, except we can't do anything in person. So in lieu of our normal event in support of Father Bill's, we are now doing our panel here, which as part of the tickets to get here tonight was a fundraiser for Father Bill's. So we're really thankful for everyone here who's joining us tonight, everyone in our in the participants window, as well as our panelists. And so this panel tonight is on homelessness and COVID-19 in Quincy. And so I'm now going to pass it on to Pat McDermott, who is, I guess I should do a quick introduction maybe, that he is our newly elected Sheriff of Norfolk County, previously Register of Probate, and then prior to that, Quincy City Councilor, and of course, still a member of our Democratic City Committee. So I'm now going to pass it over to Pat.
Fantastic. Thank you, Melissa, and thank you to Matt and to Emily for the assistance tonight in getting this program up and running. What a fantastic opportunity to do something wonderful amid the COVID-19 crisis to get us together and talk about some important topics that I'm sure would be something that Martin Luther King Jr. would be very proud of us here tonight. But generally, hello everybody. It's a pleasure to join you. I want to thank the Quincy Dems for organizing this event and our panelists for agreeing to talk to us today about homelessness, housing, and COVID-19. I think it's really fitting that we're having this discussion. And I'm reminded of something that as even though Matt said not about quoting things, Dr. Martin Luther King Jr. did say that I think speaks to the efforts of our panelists and to the Quincy Dems and for this day of service. And Dr. King said, life's most persistent and urgent question is, what are you doing for others? Simple, yet profound words to aspire and live by. As someone who's spent his life in public service, I think it's an excellent question to ask ourselves. And I know that it's a question that has probably guided the work of our panelists here tonight. Actually, without further ado, so why don't we get right into this, because our time is, this most likely will fly by. So I want to bring our attention to our program this evening and to our panelists who will share with us their work and how we can get involved in these important efforts. So I'll generally introduce our names and who our panelists are, and then we'll go into individual introductions as well. So tonight we have 4 fantastic panelists who I've known for years and have done wonderful work throughout the community. First and foremost, we have John Yazwinski, who is the president and CEO of Father Bill's in MainSpring. John, give a quick wave. And then we have Justin Yang, Dr. Yang, who is the medical director of urgent care and occupational health for Manet Health. We have, I can't say technically my former colleague because we never served together, but former city councilor Joe Finn is here tonight. He's the president and executive director of the Massachusetts Housing and Shelter Alliance. And finally, somebody who I have worked with over the years, many years, with her and her predecessor, my dear friend Rosemary Wahlberg. But our panelists tonight, Beth Strollo, the CEO of Quincy Community Action Program. So welcome to all of our panelists here tonight, and we'll kick it right in because it's all about hearing from you tonight. Why don't we spend just a brief couple of minutes each, if you could briefly describe what your organization does and basically its relationship to our homeless population here in the city of Quincy. And why don't we start it off with John Yazwinski from Father Bill's. John?
Thank you, Patrick. And I want to thank the Quincy Democratic Party for holding tonight's event in honor of Martin Luther King, and also for continuing to support our mission. Is, you know, we're always trying to get the voices of people that are experiencing homeless to be heard. And so you're giving that platform tonight, so we greatly appreciate it. Father Bill's in MainSpring, of course, started in Quincy and in Brockton back in the early 80s when people were going to our churches and saying, I just don't need a coat tonight, or I can't pay for the heat. I just don't have a place to sleep. And so, you know, it's been an honor to be a part of this mission for over 24 years. I had the honor of working closely with Joe Finn when he was at Father Bill's, and of course with Father Bill McCarthy. And so today at Father Bill's in MainSpring, we're going to shelter over 130 families across the South Shore. We're going to shelter over 250 individuals throughout the South Shore region. And we're going to support people in permanent supportive housing, over 500 units. And so we've really become a South Shore organization. And sad to say, our mission is needed more than ever. Our founders never thought that we would still be needed, but we are. In Quincy, we provide emergency shelter, of course, at Father Bill's place in Quincy at the old registry building. We've been there since 1988. And we're gonna, and on a non-pandemic day, we serve around 140 individuals a night, about over 900 unduplicated people a year. So, you know, we're excited to be talking about the homeless, the experiences of, you know, pre-pandemic, post-pandemic, and of course the challenges over the last year. But that's just a quick snapshot of what Father Bill's in MainSpring is all about. We provide that bed and that meal every night, but we also try to end homelessness one life at a time. Thank you, Patrick.
Thanks, John. Why don't we kick over to Dr. Yang to talk about, you know, about your organization, Manet Health, and certainly, you know, the great work that you are doing for many citizens throughout the community, and specifically on how it touches our homeless population.
Hi, my name is Dr. Yang, and I am the medical director for Manet Community Health Center's Urgent Care and Occupational Health Center. And Manet, as everybody knows, is an federally qualified health center that is based out of Quincy. We currently have 5 locations. Our biggest site is at North Quincy. And we also have some smaller sites from House Next, Knock Harbor, all the way to Hull. And we've expanded in recent years to Taunton as well. We care for about 20,000 patients now across the Quincy, Weymouth area. And we built up urgent care about a year ago, right when COVID was about to start happening. And ever since last March, we opened up urgent care for testing, and we've been in partnership with Father Bill's to help them with testing for all of their shelter guests and also their staff members since March. So we've done a few mass testings where we have them come in groups to get tested, and we now also do their individual testings who are guests that are entering the shelter and in isolation prior to being cleared to be with the other guest members. In addition to that, we recently vaccinated all of their staff members. That was very exciting that we get all the staff member vaccinated. And in addition to that, we have so far, I think, tested about 7,000 patients across North Quincy area, and also Taunton, and are in the effort to vaccinate even more people, and also getting ready for phase 2 when we can vaccinate the general public community members of Quincy. And I'm happy to be here today and to answer any questions and to share our experience in taking care of people experiencing homelessness during this pandemic.
Great, Dr. Yang, thank you. I'm going to jump over to Beth Ann Strollo. Beth, Quincy Community Action. Give us an idea as to, introduction to you, your organization, and the things that your organization does to battle the war against poverty and homelessness here in Quincy.
Thank you, Patrick, and to all my friends in the Quincy Democrats. And you said it, we're still battling the war on poverty. It started in 1965. We're one of about 1,000 community action agencies across the country, and in Massachusetts there are 23. We are one of 23 in Massachusetts. Our mission is to really serve low-income residents we're specifically designated to do that as a community action agency in Quincy, but we provide all of our services in Quincy, Weymouth, Braintree, and Milton, and almost all of them in Hull. And then we provide specific services around 80 different communities in the South Shore and the Metro Boston area. You'll see on this chart, we provide a range of services that are targeted to low-income individuals, and that is about people up to 200% of the federal poverty level. Some of our services are available to anyone in the public, but only a few services like our first-time homebuyer program. You'll see our picture here of our Head Start staff during the spring who were providing food and diaper and supplies to our Head Start families when all of the early childhood centers were closed except for the emergency child care centers. And I thought all of you would love to see the picture of Rosemary and Archie Wahlberg's Early Learning Center here. As Patrick mentioned, Rosemary Wahlberg led QCAP and was my mentor for many years, and they've left an incredible mark on the city of Quincy to help low-income people. We serve about 27,000 unduplicated individuals across all of those communities. And there were probably a few of our services that saw very significant increases with COVID in the spring, mostly at our Southwest Community Food Center. We had a 50% increase, ended up with a 50% increase in total unduplicated individuals for the year ending September 30. And in our housing program, about a 35% increase due to the services that we were providing to families and households, individuals and families impacted by COVID. We were administered one of the organizations to administer the Quincy Rental Relief Program, and we're continuing to provide HUD money to Quincy residents for rental relief. We provide a range of different services. You see those listed, and many of our housing services are focused on homeless families. That's primarily our focus. We are not a shelter, but we do homelessness prevention work, and we do provide some targeted housing search to homeless families for the Friends of the Homeless shelter in the South Shore. But our focus tends to be on families and preventing homelessness. I'll stop with that and answer questions later.
Thanks, Beth Ann. And I wanted to bookend this with Joe Finn. Obviously, Joe was the president and CEO back many years ago with Father Bills, and moved on to get a bigger statewide perspective on the homelessness issue. So I'd like to actually have Joe introduce himself and certainly the organization, and give us that perspective from a statewide perspective.
Oh, asking him to unmute, Joe, if you would.
We have him unmuted.
Yeah, you can tell what generation I'm in easily with this. But again, I wanted to thank Melissa for all the work that she put into this. And I definitely want to thank the Quincy Democratic Committee for this, and very quickly, I was just thinking about what we observed last week. And it's interesting that to see people, a mob, appropriating the symbols of our revolution, and a revolution that actually existed to overthrow an autocratic system, and people invading one of our most sacred civic spaces for trying to reinstate an autocratic leader in that. It's very disturbing. And so I think it's the role of the Democratic Party is probably more important than ever right now. And I think a key component of that, and I think it applies to what we're here to do this evening, is the ability to be able to tell and speak of the truth, even when that truth might be quite disturbing. The Massachusetts Housing and Shelter Alliance, as Patrick indicated, is a statewide advocacy policy organization. And what we are, a little bit of a difference though, we don't simply write white papers about policy. Instead, what we do is we advocate for resources, which we in turn invest in people and organizations that we think are taking a more innovative approach to the issue specifically. And I want to be clear about this because I know you have some experts on family homelessness here that apply more to unaccompanied adult persons experiencing homelessness. And that's our focus. We have, I'm guessing about statewide, we have close to about $14 million investments across the Commonwealth in specific programs. And especially, again, in Quincy and in Brockton, I think, again, the Father Bill's MainSpring really represents some of the most innovative and progressive approaches to the issue of homelessness of any agency in the Commonwealth, without a doubt. And so much so because, and this is what we strongly encourage, is that rather than relying simply on shelter, they continue to push and advocate for the reality of housing. Because at the end of the day, homeless are not a homogeneous population or class or subclass. What they are people, and the common denominator is they don't have housing. They can't afford housing. They can't find housing for whatever reasons, for whatever circumstances. I think we're probably going to get into it a little bit more later, but when we start to analyze and take a look at this, particularly on celebrating today Martin Luther King, it has some very disturbing consequences. Is that, in fact, if we're looking at it from the perspective of racial equity, and if we're looking at it from systemic racism I think what we find very soon is a disproportionate impact of the reality of homelessness on the lives, particularly of Black people, but also on Hispanic, Latino populations as well. Highly disproportionate response, which again fits into so many other aspects currently in our economy and our society today. And I'm hoping that we can speak a little bit about some of those things tonight, and in turn to put it in the context of COVID and everything that's happened around homelessness as it relates to the whole COVID issue.
Thank you, Joe. And I just want to remind everybody who was in attendance tonight, Melissa, correct me if I'm wrong, but if anybody has questions, they can post them in the chat, and we will get to the questions. If I see something that might be relevant right away, or we can certainly do a little Q&A at the end of all of the presentation from our panelists.
So we have
Sound
6
good?
questions that we had previously sent out to our panelists ahead of time. And so afterwards, we can definitely, if we have time, we can go through a Q&A.
Beautiful. Okay, great. So, as Joe just highlighted, all of the things that we've been doing over the last year have been kind of surrounding the pandemic that has hit us. We're coming up on almost a year now since word got out that this virus had hit our shores, and we, all of us were faced with where are we going to go, what are we going to do, and how is this going to affect our community? And certainly nonprofits, I think, were hit hard on this. I think we all know with fundraising and certainly the services that you provide. So if we could each talk about, what were the immediate needs that your organization and the challenges that your organization faced in order to continue to provide those essential services to the most vulnerable populations that you serve, specifically our homeless population. So basically, what are the challenges that you had at the time? And are those challenges the same that you have today? So why don't we start off with John and talk about Father Bill's and what were those challenges, immediate challenges as the pandemic hit, and as you evolved over the course of the year, are those same challenges here today?
Thank you. Yeah, it's been the hardest. I mean, I've been there 24 years. It's been the hardest year we've ever had. We've had cold winters. We've had people always sleeping on our floors. We were never ready for a pandemic. And we knew early on, late February, early March, that if this hit us, that our population was a very vulnerable and at-risk group. We have a lot of elderly people living with us in our shelters. We have a lot of people with compromised immune systems. And we have congregate buildings. We have people in Quincy at Father Bill's that were always sleeping on our floors. We have 105 beds, but we average in the winter 150 people. We have people sleeping in our cafeterias every night because we never turn people away. And so, thankfully in Quincy, we, in the spring, with the help of the mayor and with the South Shore Y, we were able to open up the field house when the Y was closed down. And that was huge to be able to depopulate and move 60 people out of Father Bill's immediately. So to follow the CDC guidelines, we had to go from 137 people in March to 58 immediately. And then we secured non-congregate sites like hotels. And that allowed us in Quincy to really use that for quarantining people, isolating people. And through the spring and the summer, it kept our infection rate down to 6% when the state was more at 35% because we acted so quickly. Now in Brockton, we weren't able to act as quickly. We literally put people in army tents. And it didn't work out where we had a 32% increase. As soon as we were able to depopulate and get into hotels and motels, though, in both communities and in Plymouth, we did the same thing in motels. We were able to get that infection rate down to 0 by late summer to fall. But now the second surge, it's been a completely different story. We were in a better place this fall where we had secured enough hotel rooms where we felt like we could accommodate at least keeping people socially distanced. But in Quincy, our unsheltered population since the pandemic in spring, by the fall, the street population had tripled. So many more people were finding themselves back in Faxon Park, out in our communities. A lot of people with mental health issues not wanting to come in, people with substance abuse issues not wanting to come in, and people that were just told by their landlords because they couldn't pay their rent because they lost their job to get out. They didn't know their laws. They didn't have somebody to advocate for them, and they left, and they didn't have a safe place to go. So we did have a second surge in December, Christmas week, where we had 50 people out of 58 at Father Bill's place test positive. And thankfully for Manet, who's been doing universal testing since the spring, that we were able to catch it and we would isolate all those people. And thankfully, so far at this point, nobody has died. And so we've had a response to when people do become positive, but it does speak to how we should have never allowed ourselves to be helping people in large congregate warehouse type settings where people sleep on the floors. We can do better than that. And that's why places like permanent supportive housing, this is our time. We should never go back to having people sleeping on our floors, having families sleep on our floors. Our family homeless system, our shelters weren't hit in the first phase. But this past fall, we're getting hit now with our family congregate shelters. And I was on the phone with Bridgewater State President last week, getting dorm rooms to put homeless families because of the COVID. Because the state will only take families if the whole family is positive to isolate them in hotels. And what parent is going to leave their child because the child or the parent has positive COVID? No, none of our families. I wouldn't leave my children. So it's been a real challenging time for the providers on the front line. But I can't speak enough about the healthcare partnerships that we've developed in Quincy with Manet Health and in Brockton Neighborhood Health. We literally, during the pandemic, we didn't know if we were going to be able to keep Father Bill's open. Our staff were getting positive. These are our lower paying employees, frontline workers who really were heroes, never paused, always showed up for work. And we had so many people that thankfully the first responder program that the mayor set up, we were having our staff sleeping at the Marriott and not going home to their families because they didn't want them to get sick, but they still wanted to come to work. But we had a lot of people that were elderly, that had issues, that couldn't come to work. Thankfully, we have been able to stay open, but it's been very, very challenging. And thank to the community for stepping up. This has been over $300,000 extra a month that we've had to raise to operate all these hotels and motels, all the PPP, all the food, all the donations of the food. Our volunteers couldn't come and serve the food anymore, couldn't bring the food. It's just a tremendous challenge, but we've been able to pull it off together in the greater Quincy community. So thank you.
Awesome, John. And just as a reminder, obviously everybody that's here on the call tonight, you gained access through our portal to raise money tonight for Father Bill's, and so we hope that we might inspire you tonight. Maybe whatever your donation was to get in, that maybe we've inspired you to go back out at some point tonight and maybe give a little bit more if you can afford it. It's certainly inspiring to hear those words and knowing the challenges that Father Bill's is facing. And John, you highlighted, and I want to jump over to Dr. Yang. You talk about the health care challenges that COVID-19 has posed to our society, but in specific our healthcare industry and certainly to our homeless populations. Dr. Yang, what have you seen for, you have a great perspective, obviously going back a year now when the pandemic first was coming on to our shores and certainly to our populations. What did you see at the onset? What were the challenges that you saw in the immediate? And then, how did those challenges kind of develop over the course of the year?
Yeah, and I think just echoing what you're saying, in the beginning of the pandemic, it's really getting people tested and making sure that we are getting separating the positives from the negatives, and we're keeping the population healthy. We immediately set up a response team since day one of the pandemic. I remember very clearly is that it was actually my birthday, 18th. That was the first day that we did there, and that we started testing people. And I think part of what I do, in addition to testing everybody and making sure that we provide the access to testing and to urgent care for the community. It's also research studies for COVID-19 specifically in community. We've published one in grocery store workers, and then another one that is currently in review is in collaboration with staff members at other bills that we looked at the response in Quincy versus the response in Brockton. As John said, that we were very lucky in Quincy to have YA and to have versus in Brockton where they were not so fortunate response that they had to use tent. We followed them in March and in April to see the positivity rate at follow-up testing in April. And we found that in comparing with Quincy, the Brockton tests that were, that they were stating or they were depopulating or decompressing their population by moving some of the guest members out to temporary tent. They had 6 times increased odds of testing positive in April, comparing to people, to guest members in Quincy. And that study is currently peer review at one of the scientific journals. We're trying to tell people with that study is the best way for shelter and for shelter response in a pandemic is to make sure that we have adequate indoor space or facility we can press the population. Obviously, over emergency shelter system like what we have in the States is not the solution to homeless population, but that's a very long conversation. That's like the long end goal of not having emergency shelters. However, during the, if we talk about short term, addressing the from what our showing is that we need to compress the population by having more indoor space, either renting out recreational centers or hotels, like what Father Bills is doing right now, in order to avoid infection. And that's definitely in terms of what we see in clinical data to support what recommendations to the local governmental agencies. Since the beginning of the pandemic, obviously going on for about almost a year at this point, there's definitely a lot of strengths in terms of our ability to provide service, because there's needs everywhere. Testing itself, there's a lot of different issue testing, for example, like the stress that comes with testing for our own employees, making sure that we are adequately provided protections. Initially, during the initial phase of pandemic, we were running really short of PPEs, and we are still reusing N95s. And right now, it's not that we have a shortage of N95s; it's just that it has since become a habit that we reuse them. But in the beginning days, we were short of isolation gowns, we were short of N95s, and there was definitely a panic where people were taking hand sanitizers away from our clinics or gloves. So definitely there's a lot of shortage on the PPEs beginning. And then if we had enough PPEs, we didn't have enough swabs. We're coming back, 3 to 5 days, sometimes even a week later. We get into the fall and winter time, we handle on in terms of getting the test back in time and getting an adequate supply, testing supply. And also switch a lab part right now. Our turnaround time is to like 12 to 20 hours. In comparison to in the past, it was 2 days. So we've a lot of improvement, and a lot of that comes with collaboration. We're fortunate to have the city with, making sure that we have everything that we need. We have big drive-through tent. If you guys have, driven through past our health center in March and April, the city was very kind in, sent for us and in that tent all throughout until July. It's a to make sure that we're able to community and forward. There are a lot of people still that needs to be tested, and we've seen a lot of uninsured population that is here for everybody, even if they're without who's gonna be paying for the test, and the federal government's funding is drying up. So I believe currently, if there's anyone without insurance that needs to be tested, we absorb the cost ourselves at the health center, and that's where it is. It's in terms of human resources and the need for test supplies, and also reimbursement for testing. That's always a constant struggle for us, but we're definitely there for the community whenever that's needed, and we're happy to continue to support all the organizations within Quincy area.
Thank you. So we're definitely going to have a chance, I think, towards the end to talk about our wish list as to what we're looking for from our lawmakers, from our government, from our partners. But I wanted to follow up before I move on to Beth and Joe, in terms of where we are today. But for both John and for Dr. Yang, I mean, obviously right now, the challenge now is the rollout of the vaccinations and trying to get our communities vaccinated. I know that we're limited in terms of the supplies as they're rolling out. Some would argue that it's a lot slower than we want it to be. Of course, we all want it yesterday, and there's a priority list. Where did the homeless population fit into that priority list, John? And maybe Dr. Yang, you can also help us out. How are we going to get our homeless population educated on the vaccination, and how are we going to deploy the vaccination? I mean, I see that as a challenge of today and going on for the next couple of months. So if you we could just follow up on the vaccination concept, John.
Well, for us, the homeless provider community, COVID-facing staff and the guests, the homeless population, are in the phase 1, which is really kind of, January, February timeline. So as Dr. Yang said, we were, dealing with where really Father Bill's was close to shutting down. We have 106 people in the Best Western in Quincy right now that are homeless. So we're in that first phase. And so we are hoping that, a lot of our frontline staff have already been vaccinated over the last couple of weeks. And it's been the key was for us because we had a strong partner. There's communities that just don't have a strong partner that can deliver it this quickly. And now we're really pushing to hopefully get enough vaccinations to start with with the guests that are experiencing homelessness over the next couple of weeks, hopefully.
And Dr. Yang, how are you finding that in terms of being able to administer the vaccination and to our vulnerable populations? And I think from an education point of view, it's tough too, because obviously people are weary sometimes. Sometimes they hear stories about they don't want to be vaccinated and they're not sure if it's safe. How do you talk to those populations?
Yeah, so I think definitely vaccinating homeless guests is a challenge. There's a few different aspects to that. First of all is not even just homeless population, just based on our current people that we've currently vaccinated, we see a lot of racial disparity in between people that have already been vaccinated. And even I would say within our own employees, I see that people of color are less likely to get vaccinated, even if they're healthcare workers, because there's a there's a deep mistrust in the healthcare system itself. I tried to sit down one-to-one, talk to them about their concerns, and even healthcare workers, there's a lot of concerns or misinformation on could this be an experiment on minorities and things like that. So I would think rolling this out to people experiencing homelessness is going to encounter similar obstacles in terms of education and letting people know that this is a completely a safe vaccine to be administered. The other part of the challenge that we would encounter is the mobility of the population itself. Through our study last year that we've observed in Quincy, it was better. It was about a 6% guest member that they lost follow-up with us for the follow-up testing for COVID about a month later. In Brockton, the loss of follow-up for the second swab was up to 36%. So that was about a 20-day difference from the initial baseline swab and then follow-up swab that we did. And see that, when thinking of vaccinating the guest members, it would be a concern of what if we can find them for their second shot. And that kind of sort of it's hard to manage in terms of our allocation of vaccines, because right now everybody's guaranteed a second dose. And what happens if we get somebody for dose and the concern of a second dose vaccine because the numbers don't match up is something that we have to think of how to through that. And if there is a higher level of a state level of care or coordination for guest members or people experiencing homelessness, that they would be able to be vaccinated across different sites, or if there's a joint effort in that would be mitigate a lot of the concerns that we have in terms of getting people vaccinated 28 days from the first dose. But I think those are the challenges that we see, and one of them is the big education, which we've had several seminars. We give out PowerPoint slides on vaccination to people that are getting vaccinated, and all the vaccine is definitely a lot slower than we envisioned. A lot of it to do with paperwork and administration that we have to do. Getting somebody jab in the arm is really easy. It's a 5-10 minute walk for us. It's the documentation, to the state and the same work for one patient could take 20 minutes or so. We're running up to getting at least 100 patients vaccinated every single at our health center, but the behind the scene work to get that to that place takes a long time.
Sure. Thank you. And I want to bring it over to Beth Ann to talk about the challenges. Obviously, under the greatest of circumstances, QCAP is busy and bustling and always needing. Folks are always looking for services on fuel assistance and food assistance and all of the insecurities that we see faced. What happened when the pandemic came across your door as to where did QCAP see it hit?
Well, we saw the most significant impact in our food center. We knew that we needed to keep it open. So before I elaborate on that, I do want to say that I think John and his staff faced just an absolutely phenomenal, challenging situation like they could have never imagined. I mean, we're all supposed to be doing this emergency planning and have this you know, plan in place that the state looks at, continuity of operations plan. Well, this was a complete, that just got thrown in the garbage on the first half an hour when we all looked at our coop and everybody realized this is pointless. And I really admire John and his team for what they did. It was just unbelievable. And Manet Health Center, Dr. Yang and Cynthia Sierra and their whole team, same thing. It was just nonstop, and watching them and seeing what they were going through, I think court sort of inspired a lot of us who were dealing with things on a bit of a different level. Our food center, as you know, because many of you help support our food center, which we are incredibly grateful for, saw about a 300% increase in the number of new clients who were walking in the door as soon as the lockdown happened and all of the restaurants closed, all of the businesses closed. We had many people coming in, they had never been to us before. Our challenge was to figure out how we stayed open and kept our staff safe, how we re-engineered our physical space to make sure that we were able to provide food bags and to people, and while keeping everybody safe. We pretty much had to lay off all of our volunteers. Most of our volunteers were elderly people or people with many health risks, and we did not want them to put them in jeopardy. So we had to immediately increase our paid staff, which thankfully, due to the generosity of the community, we were able to do that. But that was really critical. We very early on had an experience with one of our volunteers that we kept who was positive, and thankfully Dr. Yang and his staff got us in immediately to be tested for all the people who were exposed. We were very fortunate that no one became ill, but it taught us how quickly things can go sideways. We also worked closely with Bay State Community Services to develop a system for food delivery to COVID impacted households in Quincy, and just want to thank that team, Doris Cox and her folks, who had staff available because they fortunately had contracts in place that they weren't allowed to do any transportation of clients at that time. So instead they worked with us to, and we worked with the Department of Public Health to make sure we were aware of COVID positive households who needed to quarantine, and we brought them food. So that was sort of our food center. Our Head Start program had to shut down immediately, and our first concern was the children who we serve in Head Start, and we serve over, at that time, we served over 200 children in Head Start, rely upon us for breakfast, lunch, and a snack in the afternoon. We are their food source, and immediately became concerned, not unlike the public schools, that children needed to be fed. And so we began delivering food and having food pickup at our Head Start Center. But the challenges were also around making sure people could, we were still assessing people for fuel assistance eligibility, and then we were starting to respond to the housing crisis and to prevent homelessness by being able to make rental payments for households, in particular, specifically in Quincy at the beginning, and making sure that we could have our staff on site. We had to lock our building. Our building is still closed to the public, which is a tremendous challenge for us. We're very concerned. I think one of the biggest things we are concerned about is the ability of residents to be able to access our services, and we're trying to do creative things to encourage them to keep coming to us, but we are concerned that people are not applying for fuel assistance like they should right now. And many of them are, and particularly elderly individuals, are very used to coming into our building, talking with our staff, figuring out what they need to become eligible. We're doing that on the phone, and we're doing it through email, but many of our elderly clients don't operate through email very comfortably. So we remain very concerned about people making sure they're coming and getting fuel assistance. And our staff are in our main office on Hancock Street. Almost all of our staff are coming in because unfortunately many of our records are not digitized, and that is sort of a huge challenge for us. Again, particularly in fuel assistance, our staff need to be in the office looking at documents, and that means we have to have a constant vigilance around our office operations and making sure that we have a safe workplace, which now with the infection rates so high, we're seeing a significant change in the number of our employees who either have gotten COVID or are living in households with people who have COVID, so they need to quarantine. And that's been, that's an ongoing challenge for us.
Thanks, Beth Ann. And, you know, obviously, one of my favorite fundraisers every year is the Best Chef competition. And I'm hoping that when COVID does leave us, that we'll be back cooking those wonderful dinners from food picked right out from the shelter there, that the food pantry. And, you know, that was a great time. So hopefully 2021 will give us the opportunity to go back for that great fundraiser that you guys host every year. I want to turn the direction. I want to talk to
someday.
I want to chat with Joe a little bit, kind of open the door to a new topic. But you know, evictions. Obviously, evictions are a huge problem. That and John had mentioned it, I think, earlier. And Beth, the end, you highlighted a little bit. A little over a year ago, over at the Probate and Family Court, we started housing the housing court, and I got a bird's eye view of the volume of landlords and tenants coming in, facing evictions. And, you know, I remarked to some of the judges, you know, really the work that they're doing to try to prevent evictions from moving forward. And Massachusetts is a tenant-friendly state for the most. It's known as that in the real estate industry. And I moved now to be the sheriff in Norfolk County, and sadly, part of our job in civil process is sometimes serving those eviction notices. So, Joe, as we're moving into, you know, we're in the midst of the winter. There's the debate back and forth about the eviction moratorium. You know, when it's technically kind of the door has been opened. It doesn't seem like a lot of evictions, at least from the court's perspective, moving forward. But what are you seeing from a statewide perspective on evictions, how it's affecting our homeless population, well, how it may affect future homeless population, sadly? Are we going to see a pandemic, you know, a tsunami coming over the next couple of months if the eviction moratorium is fully lifted, courts get reopened, and that's going to happen? So, Joe, why don't you talk about that?
Well, you know, Patrick, I'm going to sound like a politician pivoting here at this particular moment, but in truth, John and Beth Ann can probably both give you a better picture of what the experience or the impact of evictions are in relation to homelessness. I think that it's important to keep in mind, first and foremost, that 80% of all the people who actually experience homelessness over time, 80% are homeless because of economic reasons. They lost a job, they lose an apartment, they lose a rent or whatever, and that begins their experience of homelessness. And again, then they're usually, their time in the shelters are short, and they've seldom come back once they've stabilized their particular type of situation. In terms of really gauging the impact of this right now, it's really difficult to tell because, quite honestly, we don't have a ton of data in relation to this. I know, however, that John and I have been speaking for the last 2 years, even before the emergence of the COVID pandemic, that people, and we hear this anecdotally, are starting to see more of what we call transitory homelessness. That is, people who are unaccompanied adults experiencing homelessness for the first time, dropping into homelessness at rates that we'd seen higher in the past. Another phenomenon that people have reported on is the is what we refer to sometimes as the new elder homeless. That is people above the age of 50 who are dropping into homelessness and who, unlike, many of the people that we see in the shelter, they have no life-limiting disability per se. They're winding up homeless solely because of economic reasons. Anything I'm sharing with you now is just based on a gut feeling, quite honestly, is that I think if I'm not worried about the immediate impact of what's happening, I'm actually worried a year out, particularly in terms of how it affects unaccompanied adults. I think that's when we'll begin to see the impact of it in terms of however this is transitioning. I think you caught today that one of the first executive orders President-elect Biden is going to sign is continuing an eviction moratorium, which is something of note. So again, not to dodge your question per se, but I think it's going to take time. It's not like we're going to see a crash right as it begins, but over time, we could gradually see people coming into homelessness. I think part of the population that we served as unaccompanied adults, particularly in the midst of the COVID, and I think John can back this up, is we deal with many people who are, for lack of a better term, what I call in the post-tenancy stage. They may not be coming from a tenancy, in other words, they're coming from any host of other possibilities, whether they're coming from the street, whether they're coming from institutional discharges or different things like that. That's who we oftentimes are encountering at the front door of the shelters. So all I can say with that is obviously we need to continue to monitor this to see what the impact is in terms of advocacy moving forward. There has been amount of advocacy, particularly, and I do think there's probably a greater impact where we see this with families, but around, for example, even in the midst of the COVID, significant increases in the RAFT program or types of emergency assistance to try in some of these situations to just simply even keep landlords, particularly small property owners, whole in some way. So I'm not sure if I gave you a satisfactory answer for all of this, but I think that's something we're going to see. But one thing I did want to make before you move off of me again is going back to the COVID situation. It's important to understand statewide in March, we roughly had about a capacity of maybe a little over 4,000 shelter spaces or beds. That was more than halved. It dropped down to the point of where I think at one point there was like around 1,500 beds statewide. John could probably tell you on the night before they began to depopulate, they had about 135 people in Father Bill's alone. And so one of the real pressing issues was people had to scramble and local communities had to scramble to find alternative space. And oftentimes it was temporary space. And so then what happened going into the fall, we were faced with another crisis because we had to find replacements now for that temporary space simply to retain capacity. And some of the really good things that happened as a result of that, believe it or not, and I think John has been a leader with this, has been the development of what we call non-congregate shelter and utilizing motels and other spaces where anybody who's sheltered has essentially a room to themselves, a door surrounded by walls, basically, of their own space. And that's been developing now across the state, despite attempts to not have it develop. That's the direction that it's been going in. So again, I think that we may see a transformation of our emergency shelter system as a result of all this. So again.
Oh, that was great. No, that's a good transition back. I do want to have John speak on this matter, but and we talk about evictions, which are probably the most paramount thing, but at the same time too, I want to say, because it's included in the conversation, is the foreclosures as well. I mean, those are probably going to be coming as well, and that probably is a smaller extent, but those can actually contribute to the same concept of homelessness. So maybe John, if you chime in and give us your perspective on the eviction issue, plans that might be in place to see whether or not this is going to spike in the near, whether it's this winter or as Joe mentioned, could be 6 months within the next year.
Yeah, and Beth Ann might know better than I, but so we have a state contract. We're in 5 housing courts in the South Shore, and we've been there for years. And thankfully, we've had this moratorium, or it's going to affect families more. It's going to affect families that are going to get evicted. The moratorium is lifted, but in Massachusetts, and thankfully, the housing court judges are really being compassionate through the winter. They are really working with our teams. They're working with the families and the owners. But you're right, these property owners, some of these people, that they're going to lose their home. So I think we've got people that have been out of work, that we're seeing coming in, families been out of work since April, May, and June, that were laid off, and they've got mortgage bills that they haven't paid, or they've got rent that is, almost $20,000. No rental assistance program, and the governor has put really a lot of money behind this. He's got a lot of boots on the ground to help, but there could be this could be a tidal wave in the spring and in the summer if we don't figure this out. And I think the most population is going to be faced with it's going to be families that are going to experience homelessness if we don't figure it out. Right now, even it hadn't been lifted. We got through the majority of the pandemic. It is lifted now, but everybody's looking at it. Let's really look at the winter, keep families safe. Over the last 3 weeks, we have seen families that have almost had to sleep in cars. In Massachusetts, we've never had that. We've always had a compassionate response, a response that's very driven about emergency sheltering. We were in motels and hotels for a long time in this Commonwealth. We don't want to go back there, but we're starting to see that crack now. And I don't want to keep going down that path where we're stepping in and putting families out there because they fallen through the cracks because of either a mortgage or rent and they've gotten evicted. Small cracks right now in the system, but we get over 30 calls a day from families saying, I am going through the process and I am scared. I'm going through the process and I am scared. So I'm very concerned about the future.
Thanks, John. And I want to balance it out a little bit too, because even myself, I own a rental property as well. So landlords themselves, sometimes we paint the landlord as this evil person. There's a lot of local folks, me, several people, you own a couple of properties here and there, you own a couple of 2 families. And, we depend upon our tenants to pay our rent in order for us to pay our mortgages. Because if we can't pay our mortgages, and I talk about the foreclosures, landlords are going to be getting foreclosed on by the banks. And those banks won't think 2 seconds about evicting people. So we need to make sure we balance this out with rental assistance, as well as and luckily, the state, the Commonwealth has been great at helping landlords, as a business to try to offset and you work with your local bank to try to offset your mortgage payment. You can put it on the end, you can do a modification. But Beth Ann, talk to about, this issue of evictions and that issue of families, as John mentioned, families getting evicted and, where this crisis could put us in place for rental assistance, or where do we go?
Well, what we're seeing, the same kinds of things that John is. We are in the Quincy District Court, and once the courts reopened, first they had about 130 cases that were backlogged from pre-COVID, so they had to deal with those first. And we were, in there with rental assistance, emergency rental assistance money, and linking them to the RAFT money. I think one of the biggest problems right now, there are not enough people, there are not enough housing counselors to process all of the needs of the clients. There's money there. The state has stepped up, and the state, I believe last week, put in an application to get part of the $25 billion that the federal government has put out there. I don't know, I don't think we know exactly what that's going to mean for the state yet in terms of additional money coming down to help pay rents, but the state had already stepped up and increased the RAFT program. We'll pay about $10,000 towards back rent. We have, so in Quincy, we can match that with another roughly $6,000. So we can take care of somebody but the line is long and the process is taking longer. So it means that we're asking landlords to be really patient and asking tenants to be patient. And that isn't an easy thing to do because they're nervous. They're all nervous. And I couldn't agree more, Patrick, that we are very concerned about the landlords, you know, and it's all the landlords. I mean, even some of the larger property management companies, after a while, those property management companies that tend to house a lot of low and moderate income tenants, and there are a number of them, they're feeling this more disproportionately than others. And we're very concerned about that. And it isn't going to go away quickly. John's right. This isn't going to be, we're not seeing the full effect of it yet, partly because the eviction moratorium was in place. And so people they're not even calling yet. And some of the landlords are not even starting to process paper on this yet. So people are just kind of sitting there with these arrearages building up and building up to the point where we could end up, if the eviction moratorium is extended, we could end up many months from now with people owing 1.5 years of rent, which around here, you know, that is a huge number. And our message to folks is apply, come now and get in there now. Even if you don't have a notice to quit and your landlord has not moved on trying to evict you, you know you have an arrearage and we can help you now. But the line is long and we don't have enough staff. We're hiring. So if anyone knows anyone, we're hiring housing counselors. And so isn't all of the regional nonprofit housing agencies that are managing the RAFT money. But we're very worried about what it's going to look like in the future. And we know that many of these folks, they're the first people to be laid off and they're the last people to be hired. And that is always the case. We saw it we see it every time there is a recession or economic fallout. And we're very concerned that we're going to be working with folks 1 year, 2 years from now who are in very tough shape economically.
Thank you. Yes. You know, you mentioned starting to look toward, as we look towards the future, I think as we pivot on, and I'm gonna throw this back on Joe Finn a little bit, but maybe give a bird's eye statewide analysis of, you know, we've basically been dealing with a, you know, obviously an emergency pandemic, a crisis moment. We're still in crisis mode, but I assume that your agencies are also kind of pivoting a little bit towards the future. And we got to get back to that discussion, which is ongoing, about permanent, long-term, affordable housing opportunities and the policy advocacy that we have to put in place. You know, maybe Joe, if you could like open the door to talk about, you know, some of the long-term housing initiatives statewide that we're trying to accomplish or trying to advocate for, and then maybe get a perspective here, Beth, back in Quincy, you know, what Father Bills and QCAP are putting together for a long-term initiative for that long-term affordable housing. Joe?
Well, you know, I always love to say in every talk I give that the Commonwealth's approach for the last 40 years to homelessness has been emergency shelter. And the outcome of that has been simply more and more homelessness. It's really not addressed the core problems. In fact, there was a state rep back in Chris Hodgkins from out in Berkshire County in 1986, I believe it was, during the Dukakis administration. It might have been 1988, but he got up and he said, if we don't ask the question of what's causing this problem, we're just going to be adding shelter beds forever. And that turned out to be prophetic, because that's exactly, in my mind, what has happened. And I think that now we're in a situation, I think that prior to even speaking, and now again, I am speaking as it relates to those unaccompanied adult persons, not families, who are experiencing homelessness, but we have to get to the point now where we need to actually transform based on what we've learned through this pandemic, that we have to transform the so-called emergency system that we have. I think this COVID crisis really laid bare just how poor and how inappropriate and how unorganized our whole system for addressing this homeless issue is. And so one of the things that we have been pushing for very strongly is trying to transform that system from a mass sheltering system into what we call a non-congregate shelter. Exactly the stuff that John is doing, I guess it's in Brockton, John, right? And trying to do in and around Quincy as well. But basically, again, provides a room or an efficiency almost for the people that they're serving, and that more people are apt to come in, more people are apt to work with that. I think one of the things we also know is that our whole emergency shelter system is completely and totally disorganized and inconsistent. Again, speaking about unaccompanied adults, we are not run through the Executive Office of Health and Human Services. The sheltering system is run through the Department of Housing and Community Development. So even in responding in this pandemic, there are all kinds of great protocols and systems for testing, for vaccination, for all of these different things that were laid out for EOHHS. But we on the homeless side really had to fight, quite honestly, to get anything. And I'm glad and happy to report that it's getting better with each day, but it pointed out again how little thought has gone in to even addressing the issue of homelessness. So first and foremost, we have to think about what, moving forward as it relates to housing, what are the types of housing that we need? And we know, again, that people are homeless for a wide array of reasons. So when it comes to unaccompanied homeless, on any given night, about half of the people John serves and across all the shelters across the state, they're dealing with what we refer to usually as chronic homeless individuals. These are persons who, aside from being homeless, also have some really serious life-limiting illness, most often, quite honestly, oftentimes serious mental illness that's part, and again, reflects the lack of our main care systems of care for dealing with these particular populations. And so something that Father Bill's MainSpring and something that the Massachusetts Housing and Shelter Alliance has pushed is creating the appropriate amount and inventory of permanent supportive housing units that are necessary to basically empty the shelters and to kind of create, again, a different alternative for that population as opposed to, packing them into mass sheltering types of situations. But there are many, even those who are individually homeless, there are much less expensive approaches to those populations, again, dependent on need. For many of those who we call transitory homeless, they would benefit from, again, a simple shallow subsidy that would allow them to get through whatever specific crisis they were having at that particular moment. Not even a long-term subsidy, just a short-term subsidy that would be far less expensive than packing them into a shelter where, again, any number of things could happen because as we've discovered, as it currently exists, it's not a particularly healthy system. So I think that what we really need to do is we need to get the state, both the executive branches and the legislative branches, committed to trying to develop predictive modeling necessary to determine the amount of need, which is not as great as one would think, to develop the necessary permanent supportive housing units we need and to put into place a more robust emergency response type of system that we could have, relying on a variety of housing resources. One last point I just want to make, just to stress this, Blue Cross Blue Shield Foundation did a study of all the programs that we've housed through what we call our Home and Healthy for Good and our Pay for Success. And they looked at over 1,600 Medicaid claims data of the people we've housed over the past decade. And interestingly enough, what they discovered through utilization is that it's far less costly in terms of medical care for someone to be housed than it is for them to be homeless in terms of, because in the homeless, they, create so much costs in emergency care, so much costs in acute care. So we really want to make, I think another point with that too is that over in that cohort, the intervention cohort, over 93% of those in permanent supportive housing had a diagnosis of serious mental illness. So again, it's going to take some work, but we have to have not one set of housing. Currently, like for example, one of the mass rental voucher program, one of the most significant housing voucher programs we have, it's almost useless in terms of dealing with chronic homeless or putting resources into somebody like Father Bill's MainSpring's hands in order to make a real difference, just because of all the requirements that are built into it, that they're not adequate for that population that we serve. So again, we really need to shift to a permanent housing approach for everyone who's homeless, and also making certain that we have adequate services that are necessary to support the tenancies for those people who have some type of long-term life-limiting disability.
Exactly, and that leads a great, if I could open the John, obviously we talked before the call started about some of the great things that Father Bill's is moving in the direction of, and maybe some of the things that you've done in Brockton that are going to be here in Quincy, and some of the new initiatives, that new plans for transitioning homelessness into, true housing for people. So John, why don't you talk about that, some of the hope things, because this is, you never want to be fully, we are in an emergency, a little bit of gloom, a little doom, but there is hope, and we're trying to push forward, and work that you were doing, and certainly we'll get to Beth Ann as well. There is hope in some of these things, some great things that are on the horizon. So.
Yeah, so we're really excited, when the city and the mayor was talking about building the public safety headquarters, a new police headquarters, and we knew that the shelter was vulnerable, where they wanted to be a part of the development. We looked at that crisis as an opportunity and presented to the city an opportunity to say, listen, let us be part of the development, but we just don't want to build a new building and have it be an emergency shelter, to have it be another Father Bill shelter. We're going to take the best practices that we've been doing throughout all of our programs, and we're going to look at the best practices in this country and bring it to Quincy. And what we're going to be doing is we're going to build a new facility that's not just going to be a shelter, but it's going to be a housing resource center that is going to work on, for individuals, going to work on prevention, diversion. Diversion, about 20 to 25% of the population that we see come from other state systems of care. Patrick, come from corrections, come from mental health hospitals, come from detoxes, come from rest homes and nursing homes. So if we can divert people from ever, working with these state agencies and public agencies, and say, if you've got somebody that might end up at 38 Broad Street, let's start working with them now, and so they don't end up at 38 Broad Street. So it's creating a new response that is about progressive engagement. It's about prevention, diversion, and it's about using the shelter model. Instead of saying it's a shelter, use it like a medical emergency room, right? You go to the emergency room. If you need a Band-Aid, you get a Band-Aid. If you need intensive care, you get intensive care. Somebody shows up at Father Bill's tonight, you're just getting the bed and the meal. But if we could start to get upstream a little bit, prevent people from being inappropriately discharged from our state systems, get ahead of it and prevent people from facing homelessness. If they just need $500 and not end up in the shelter, let's give them the $500. And to rapidly rehouse people. So if people do fall through the cracks and end up in our shelters, then let's pay their first, last, and security if that's all they need, and let's get them out. It's about reducing the length of stays. So we're going to create a new facility. We're excited with the city of Quincy. We have a 99-year lease. We have site control of across the street from where the shelter is at 39 Broad Street. And we're not going to just build a new facility that is for a resource center that still has emergency shelter beds, but it's also going to be 30 units next to it of permanent supportive housing for the homeless, 0 to 30% median income people. And we can't build our way out of this, of course. So bigger picture, it would be great to have more of a mixed income housing strategy. When we're developing thousands of units of housing in the Commonwealth, make sure that every facility, every building has affordable housing for all income levels. You know, the people that are working at our Dunkin' Donuts today, the people that are working as bank tellers today are staying at Father Bill's place today. People at our grocery stores are staying at Father Bill's. We want these essential jobs. We need these people to be in our communities. They can't afford it. So yes, Patrick, we are very excited and thankful that the city has signed off on our new initiative. It's been part of our strategic plan now for about 8 years. We've been trying this out through a variety of our different programs. Now we're going to bring it all in one location. It's a bold attempt, but we're really, really, really excited about it.
Thanks, John. That's what we wanted to hear about different strategies. You know, as Joe mentioned, you know, we've been talking homelessness issues for years and years, for decades now, and yet we still going, but still for some reason kept on going back to that same old. So new vision, new initiatives are great, and certainly I want to turn over with Beth Ann. You know, affordable housing, and you know, it's not necessarily just like our homeless population. As John mentioned, it's the Dunkin' Donuts employees, but it's the local regular folks. You know, regular folk, working class folks who can't afford necessarily sometimes to live, and throw a pandemic into the mix. And obviously there's a whole host of problems. So, you know, what are the things that you see at QCAP in terms of the affordable housing programs that we want to see put forth in the city of Quincy?
Well, I first want to just say that what John just described is a really exciting initiative, and I want to congratulate them. And I know this is a fundraiser for Father Bill's, so they're going to need a lot of help on that initiative. And the city, I know, is very supportive, and we're really pleased to hear that. You know, in terms of public policy and what some possible solutions are, we can't forget that the federal government has walked away from affordable housing. About 50 years ago, they walked away from it. When was the last time you saw a sizable investment by the federal government in affordable housing? It's gone. It's been gone. You rarely hear presidential candidates talking about it, even Democrats. They might speak about it a little bit, but it's not a focus. And yes, we have so many problems on the federal level, but this has been really a tragedy that the states cannot fix this on their own, particularly the states where the cost of housing is so high, like Massachusetts and California and New York. So we need the federal government to step up. A lot of the, John and Joe know this better than anyone, the programs to develop affordable housing, the funding to develop affordable housing are so difficult to access, and the rules are so intensive that it discourages for-profit developers and nonprofit developers from building it. And when you add on resistance that you get from many communities when you start talking about an affordable housing development, you kind of create this perfect storm of it delaying it and people not willing to create it. We're fortunate in Quincy to have the inclusionary zoning ordinance, and there is a requirement for developers to contribute to affordable housing, but it's not a requirement to build it on site. Joe and I have had about 5 million different conversations about this, and Patrick, you probably have with many people as well. We won't debate that right now about whether it should be on site or not, but think about what would have happened downtown and around the entire city. I don't know what the number is. It's some phenomenal number of units have been created in Quincy in the last 5-ish years. I want to say, John, Joe, do you know? Alicia, do you know? It's like 5,000.
I was gonna say it's about 4,000, I think. It was projected to be because over that long-term build-out, was a 20-year build-out, they could see, double or triple that over the course of 20 years.
Right. So how many of those were affordable? Not very many. And there was money put into the fund, and so we have the trust there, and there's money there, and it's going to help things like probably Father Bill's build that. It helped prevent, that money was used to pay for rents during COVID. So those were good uses. It's being put to good use, but it would have been much more efficient and immediate if the developers would have been required to put those units on site. And it is for teachers and working families. I mean, at QCAP, the people we serve there are very few, less than 5%, that collect TAFDC as their main source of income. We serve over 27,000 people, and the vast majority are either retired and on a fixed income, or they are working, and they are working poor families, and they cannot afford to pay $2,000 a month, which is cheap in Quincy, when they're earning $20,000 a year. So it's just such a conundrum, and we're not even close to having a solution, but the federal government needs to step up.
Great. No, that's a good point, and I didn't even think of that angle as being the case. So we'll be on it with Congressman Lynch as soon as this inauguration gets through. We're all over that. I want to pivot the conversation a little bit. I certainly want to bring Dr. Yang back into the game here, but one of the things that has happened over the last year through the pandemic, and largely based, when problems with the George Floyd situation came up, we certainly exposed in a greater way than it's ever been exposed the issue of racism, systemic racism, and racial inequity. Basically, I mean, across the United States, communities of color are bearing the brunt of the pandemic's health and socioeconomic consequences. The COVID-19 is intensifying the daily impacts of systemic racism on people of color who are already experiencing limited access to resources such as housing and healthcare. According to our most recent data, it looks as though people of color make up approximately 40% of Quincy's population, and more than 30% of our city are Asian residents. So maybe if we maybe shoot this back to Dr. Yang, because you had mentioned it before about, in terms of people being distrustful, but in terms of access to healthcare, have you seen this issue of racial inequality and equity as being reflective in your organization as to the services, certainly the healthcare services that you see at Manet, and access to folks, and seeing the racial disparity? If you could comment on that.
Yeah, and I think just to connect with what John and Joe have been saying about eviction and everything, I think that's also connected together with healthcare as well. And as we see that, and as Joe mentioned, that when they're homeless, when they're experiencing homeless, their healthcare costs goes up a lot. We also are seeing a lot of shelter guests that have very uncoordinated healthcare. They don't have a primary care doctor, and that's what we've been trying to do to sort of pair them up with our primary care doctor as well. And a lot of access to behavioral health providers. That's also a big issue for the homeless shelter guests, especially when we look at substance use disorder and treatment for substance use disorder. That's often disconnected, and that often affects a lot of people of color that are experiencing homelessness as well. And I think throughout the pandemic, back to your question, I think that we definitely see a lot of especially for immigrant population here in Quincy and also in Weymouth, that are not connected to care, or that they're not connected to enough information for COVID and in relation to how they should be taking care of themselves, isolation or quarantine instructions. Even though that we try to do our best, a lot of times it's getting the information to them is difficult in their own language, in terms that they understand. Just, you know, having updated and adequate and insurance and access to care has been a struggle for especially that we see a lot of immigrant communities, people that just got to the States within the past few years, that don't speak English as well. That's a big issue. And in terms of you know, African Americans, I think that's definitely a significant portion of people that have not being able to access their healthcare in comparison to people that in comparison to other races. Like when on a day-to-day basis, when I see people that are coming to us for testing, the majority of people are not people of color, and it's disproportionate to what the racial proportion is in Quincy. That tells me that the people of color here in Quincy are not getting enough access to testing, are not getting enough access to urgent care. I am not sure of why, but that does show up in terms of the people that are coming to testing. I do not see a lot of people of color, but I do see the majority of people coming to us to get tested are either Caucasian or Asian community. And we do have a lot of Asian patients as our population base, so that's not surprising. But other race and ethnicities, we're not seeing a lot. And that is a question that I have in mind in terms of why they're not accessing their care. Is it because of transportation? And a lot of times we do see people with transportation issues. They can't come to get tested, and therefore they're not getting tested. Or is it because of their job? And that's even more concerning, because they are not getting tested because they have to be at work. They're for fear of, you know, getting fired, because a lot of the jobs are temporary for them and they're not full-time staff members. They don't have benefits. So that's concerning, that they are going to work not being tested and not knowing that they are positive or not. So I think there's a few different components, and definitely, and as we know already, that race has plays a lot in terms of access to care. And I think the pandemic is just increasing that disparity between different races, and I think that's something that we definitely need to address.
So Beth Ann, you know, in terms of this issue of racial inequity, do you see it, you know, through the eyes of QCAP? Do you see that there's a disproportionate in terms of access to the services for folks of color in our immigrant population?
Well, what we see is that there's a disproportionate number of people who come to us who need help. So while the Black population in Quincy is about little over 5% of the total population, out of our Quincy clients, 12% of them are Black. So almost over double are coming to us for help. During the pandemic in our food center, we saw a 52% increase in the number of Hispanic individuals who came to us for help in the food center, and a 37% increase in the number of Asian families who came to us. So those are, you know, kind of, that was focused on what was happening during COVID. But we definitely have always seen a larger percentage of Black households coming to us for help compared to their proportion to the population. And that's really the economic inequity issue and the racial and economic inequity coming together that we know is true and have seen it forever.
Yeah, and I guess that's the issue too. And I may have asked the question the wrong way, because access is always in a QCAP, Father Bill, access is always there for anybody, no matter what their race, creed, color, is. But it's the disproportionate, as you highlighted, is the disproportionate amount of folks of color, and the immigrant population who need the services, and that's where the balance is, I think, off. And John, do you see the same thing with our homeless population on a day-to-day basis, or is it different, or what's your views on it?
Well, like in Quincy at the individual shelter, I think we're above, what the census is too for Quincy. We're at 80% Caucasian and 15% Black and 6% Latino. And so, but across the South Shore, if we take all the programs, especially on the family side, we see a lot more people of color with single parent households that are experiencing homelessness. But it's about, of all of our programs, it's like 50% white and 39% Black, 6% Latino, which is similar to the demographics of our staff at Father Bill's and MainSpring, 54% white, 35% Black, 8% Latino. So, again, what we're seeing in Quincy is definitely a disproportion of people coming in. Thankfully, we don't see high percentage of people that are Asian coming in that are experiencing homelessness. And I think that we've done a lot of outreach to the community. And I think what we're seeing is a tremendous amount of people that are doubled up and are kind of staying within their larger households there. And with COVID, clearly with the gateway cities that we work in, that's what we've seen is the communities that have a lot of people that are doubled up, sleeping on floors, sleeping on couches, especially triple deckers, that the COVID virus just spread so quickly in those neighborhoods.
So Joe, from a statewide, from a resource, from your agency, what you've seen, not just, obviously the last year, but you've probably been studying this and have experienced this for many years in terms of this issue of inequity, racial makeup of access to services, and what's the statewide outlook on this? What's your perspective?
In terms of numbers, it's highly disproportionate. What I did was I basically, in preparation for this today, I took a look at the HUD-AHAR statistics and what they call point in time count, which again, it's not a perfect count, but it's still interesting, and compared that against the, the census estimates for the same period of time, 2019. And it's really, quite disproportionate, because if you look at that, in the population of the Commonwealth is about 80.6% white. White along with not Hispanic is around a little over 71%. Their share of homelessness is of the homeless population for the FY point in time, for the point in time count for 2019 was 52.4%. If you look at the Black population, it's about 9% of the total population. And in Massachusetts, that accounts for 34.8%. And if you look at those with multiple races, only 2.6% of the population, well over 10%. And also, finally, again, in the ethnic side, not so much the racial side, but Hispanic, Latino, if they represent about 12.4% of the population, they represent about 39.5% of the homeless population. So clearly there's a disproportionate number in terms of the actual people who are experiencing homelessness. I'm not entirely certain we can say yet, Patrick, that access isn't a problem, because I think it may be in certain ways. And that's, we've recently received a grant to look at issues related to racial equity. But in terms of systemic racism, it's not always about evil intent per se. It's about systems that have been built for whatever reason in different ways. But there could be factors that actually do not capture the full experience of Black populations as they're experiencing homelessness, for example, and yet the programs and the regs and the things that we put in place to serve them, basically can actually block them out of accessing some of those programs. And so I think we have to take a really hard look at some of these things. I'm sure in your new role, this has got to be a very serious question for yourself in terms of systemic factors. I mean, in terms of disproportionate populations, in terms of sentencing, for example, sentencing, length of terms, all of these different things. There seems to be some systemic injustice that's built into this. And so I think it really is going to require us taking a much closer look at how some of these things happen. And in Massachusetts, I can tell you that's not going to be easy. Racial data is very difficult to come by. I mean, one of the things that, I've been trying to analyze for years, Medicaid claims data, Mass Health data. Well, interestingly enough, Mass Health does not collect that in its applications and the like. So all systems are trying to figure this out in terms of what equity means, in terms of access and people, receiving services. I sit in on some of the advisory boards for things like the quality realignment for Mass Health and commercial insurance payers. They're all trying to figure it out. And the difficulty is that they have such limited access to data that really can help them understand what's happening and what's going on. So I think there has to be a real serious commitment to this that is really taking a look at the equity and disparity issues that can exist within these various systems that at this point we might not even be fully aware of. So I think it's presents a big challenge for all of us.
Exactly. And, and you mentioned, my current position now, and I've only been on the job for a week. When we go and run for office, at least on the city council level locally, I know you did it as a large council, where favorite pastime is going door knocking. So Saturday, I actually had the opportunity to spend my time door knocking the 1A unit, which is our sentenced inmates at the Norfolk County Correctional Facility. And I went with the superintendent door to door as our population was, they have rec time, but then there's time inside the cell. And we had, myself and the superintendent had an opportunity to go door to door in 1A, which is unfortunately now a COVID unit. We had some positive tests. It afforded me the opportunity to speak. And what I was shocked, I guess I shouldn't have been shocked, but I just was when I went door knocking. There wasn't a lot of Caucasian men in that unit. Door to door I went was Hispanic, African American, Black and brown people, men, and they all talked about the same thing. About some of them were talking about bail issues, and they found themselves in jail because they couldn't get bail. Others have talked about access to housing, and I know you and I have talked quickly about just one of the things I focus predominantly on is the reentry component for people. And so I'll be working hopefully with each of you on that reentry component for these men who are coming out, because we don't want to see men who have committed crimes going back on the street only to commit crimes again. And most of the time it's systemic issues relative to race, relative to housing, jobs, food insecurity. So
I think there's like social disparity types of issues as well too, because for example, many of your colleagues have referred to the county jail system as the de facto mental health system for the Commonwealth right now. And you will see people with serious mental illness who cycle in and out of your programs. And then add on top of that, the same type of disparity and iniquity we've been describing oftentimes keeps grants lesser access to Black and Hispanic families to mental health services or resources. So it's like it's a real difficult issue that I think is going to have to take a lot of honesty and courage to really just look at and try to think of better ways of organizing some of these resources.
So which helps us transition to we have a final question for the panel in general, and something I've been doing as sheriff as I start, getting ready to do my own advocacy for what my needs are, pushing things on the Hill, and we eventually as sheriffs go down to Washington, D.C. and meet with our legislative delegation there. If you could put together, a 1-year wish list with, what if you were going to go to the Hill and advocate with our lawmakers as to what we could see to affect your respective, whether it's homelessness, COVID-19 healthcare. What do you think would be on that wish list for that 1-year initiative? When we can knock on the door of our state reps and senators, the governor, what would that be? Why don't you take the first shot at it, John?
Okay, so I guess I'll take it right what we're trying to do right now, and that is we in the spring started to advocate for non-congregate housing, that we got to get away from this congregate housing, the sheltering environment. And so one of the things that we're trying to do right now is we've reached out to a lot of owners of hotels and motels that maybe aren't going to make it because of this pandemic, and saying, hey, can we reinvent the hotel and motel to be permanent supportive housing if it's going to get foreclosed, if it's going to not be available? And so we're trying to do that in Brockton right now. We are in a 68 unit hotel as a depopulation shelter site, but it is very easily convertible to efficiency apartments if you add a kitchenette, and to be 68 permanent units of housing. It reminds me of the 80s, when we started to see rest homes, a lot of, community neighborhood rest homes closing, and they've sat in our communities. We have 2 rest homes for family shelters now. So this could be an opportunity where if we are going to lose certain facilities, if there are vacant buildings, haven't we learned during this pandemic that we can do better for our homeless and not have large congregate settings on a public health side of it? So I would really push to get capital and operating support. This is a moment in time now to develop permanent supportive housing. And if the hotel motels are just one example of getting certain non-congregate sites on board in 1 year, let's do it now. Thank you.
Excellent. Dr. Yang, healthcare access. What are we looking at for our legislators, our government officials on a solid, not even a wish list, but what are we advocating for going forward from this day forward?
Yeah, I think for us, definitely throughout the pandemic, financial restraint and also operating restraint has always been a big thing about getting everybody tested, and now it's the second phase is getting everybody vaccinated. We are looking at different sites together with City of Quincy, looking at not abandoned, but buildings that are not currently being used to set up as a vaccination clinic for us to roll out to vaccination to people experiencing homelessness and to the general population, local communities as well. I think part of that is, we have the location, and then the other question is finance-wise, how are we going to be able to get the operating staff that we need? Obviously, we can't do it alone, and we are, as of right now, very tight in terms of getting, seeing our own patients, because everybody at this point, especially healthcare workers, is very pandemic fatigued because we've been dealing with this for a whole year. So getting people to help us with registration, with registering people for vaccinations, with a lot of mobile testing, and vaccinating people at different sites. That's where, if I say I have my wish list of what I hope that the government could help us, that would be one thing, is how we're going to be able to scale this up, to bring the testing to the local community instead of having them come to a specific site. And then also, how do we vaccinate everybody in the shortest time possible? And that is really a lot of human resources, that unfortunately we just don't have right now. So that would be a big bucket list of mine.
Awesome. And so I turned to my friend Beth Ann, obviously back in the days in the 90s, having served in up in the legislature as an aide and serving on the board of QCAP, as a Ward 3 city councilor. One thing I know about Quincy community action programs is the level of advocacy that you and your organization puts forth on the state and the federal, state, and local level. Consistent advocacy, that phone always ring. And you know what's great about when you get a phone call from Quincy Community Action? You can feel that the compassion and the passion that comes from that organization. So I have no doubt QCAP is putting forth your own plan for this coming year. And what are you pushing, from an advocacy point of view from our federal, state, and local officials to make sure that access to these services remain solid?
Well, we're looking for right now, hopeful that we can be part of helping with vaccine education, which we're very concerned that our clients are going to be very resistant. Others have talked, Dr. Yang has talked about it, and others have, that is a serious concern. And I think some of the things that Dr. Yang was just mentioning around the need for local vaccination sites is going to be key. It's great to set this giant vaccination site up at Gillette Stadium, but our clients will never be able to get there. That will be just completely untouchable. And even something like Fenway Park is just not going to be easy for them. So I think having something on a local level will be incredibly helpful, and we have to make it easy for people. We're always pushing on the federal level for enough resources to serve our clients. There is a lot happening right now, and there has been since the first CARES package was passed, and we've been grateful to receive some of that to allow us to make sure that we continue to provide fuel assistance. But I think just sort of stepping back away from the COVID pandemic, we need more housing subsidies. I mean, we need to produce housing, but housing subsidies on a federal level are very quick solutions to getting people affordable housing and utilizing existing apartments and educating landlords about who it is that will have a Section 8 and encouraging them to accept that Section 8. That's always a challenge with folks who have an MRVP or a Section 8 subsidy, is to there is resistance sometimes by landlords around stereotyping who it is who is eligible for affordable housing, and we're always trying to break that down. And I think particularly right now, when we look at the horrific events of last week that happened in Washington, and the anger and the violence and violence at many of our clients, the feeling of that, we're very worried about what that's going to mean as we move forward, and thinking about ways that we can get that dialogue going in the community. It isn't going to be easy, and we're fortunate to be in a community that you don't see a lot of that blatantly, but it's there. We know it's there. There were probably plenty of people from Massachusetts, we probably don't know all of them, who might have been there in Washington, and we really need to be thinking about that education effort because that impacts not just people of color, but other individuals who are low income.
Excellent. Yeah, I want to put in. This has been, so far it's been a great. We're right on time, and I just want to finish up the formal presentation now, and I want to ask Joe, to maybe wrap up in terms of that final question here about what would be the wish list, as you see going forward when it comes to housing and affordable housing development. What's that one wish list if we can go to the Hill and talk to our legislators on?
Again, because this is the last time I have to speak, I do have to say this before I finish. I was involved as it dealt with the COVID with just about every community in the Commonwealth. And the thing that separated out communities had these really great responses from those that were in like real chaos were often those communities that had a really active and engaged community health center. And let me tell you, there was none better than Manet Health. How they responded to this was unbelievable. And Cynthia Sierra deserves a medal in terms of what she did. It was just absolutely incredible. And I just really wanted to say that. Before my wish list, which again, you can be sure I'll be up there saying, pounding some of these things, but on the executive branch side, I would love to see them, and I'd love to get the legislature to convince them that they should be trying to use some type of predictive modeling to come up with a rational number of units that's needed to dramatically reduce shelter capacity by taking those with serious mental health, serious substance use disorder issues out and into more appropriate kinds of settings, which would dramatically drop the need for demand. But also, I'd like to see a housing product developed, and it kind of goes to some of the stuff that Beth Ann was speaking about earlier, that would provide a flexible way to provide both the sufficient capital that's going to be necessary and service and operational dollars for developing permanent supportive housing. John Yazwinski didn't tell you how many things he has to go through to just try to put one project together. He's got about 15 different things, and all of them just keep driving up the cost of it. So what we're really pushing is trying to come up with a way of bringing what we know works to scale across the Commonwealth. So that's been kind of our push and what we continue to push moving forward. That's about it, but that's what it's going to take to end this. We have to address the permanent supportive housing piece.
Awesome. Well, I just want to say thank you. We as we celebrate the legacy of Dr. Martin Luther King today, I want to thank our panelists, John Yazwinski from Father Bills, Joe Finn from Mass Housing, Shelter Alliance, Dr. Yang from Manet Health, and Beth Ann Strollo from QCAP. This is truly a great testament of what Dr. King talked about. I think the movement of his vision about a world where racism doesn't exist, and a world that we all come together in a spirit of cooperation and focus, and to be a population of resiliency and determination, to the old anthem of "We shall overcome." And I think that that's the theme that we need to consistently push for, and I know that your organizations consistently push for that, about overcoming the challenges that we currently face under this pandemic, and certainly under the issues that we will face post-pandemic. So I thank each and every one of you for your participation tonight. It's been a robust discussion. I want to now turn it back over to my friend Melissa. I see that my other friend Alicia Gardner is waving. I'm not sure if she's going to say a few words. Are you? Okay. So why don't we, Melissa, before we go back to you, because I know you have some things, why don't we let the chair of the Quincy Democrats chime in real quick. Alicia Gardner, you can unmute. Let me see if are you unmuted? Hold on. There you go.
I'm unmuted. And I did want to thank all of the panelists tonight for being here. Your information has been incredible. I want to say Quincy should be very proud of the leadership of our nonprofits in the city and beyond. They are incredible, and they've been doing it for years. And I can't thank you enough on behalf of the residents of Quincy and our catch basin on the South Shore. You are amazing individuals who continue to assist those in need. I'm so proud to be a resident of Quincy, and I want to remind all of our participants tonight that this is a fundraiser for Father Bills, but on our website, we have provided you with access to each of these nonprofits' websites, and I encourage all of you to continue to support them on behalf of our fellow citizens. And I really thank you for all your efforts on our behalf. Thank you, John. Thank you, Beth. Thank you, Joe. Thank you, Dr. Yang. Manet, I was a president of your board. I love you. I love Cynthia. Beth Ann, you have my heart. Joe, you know that. John, I'm so lucky to have you in my lives, and I'm so proud to call you my friends. Thank you for all the hard work you do on behalf of all of us. Thank you.
Thank you, Alicia. It's my honor to do it, and my staff who are really doing it. And I have to throw out that thank you to Cynthia Sierra. She has saved me, I don't know how many times since this pandemic has begun, and is working 24/7. I'll email her at whatever time of night, and within an hour I have a response. And I told her last week, she did it again. I said, don't reply to this until the morning, but she didn't.
Oh,
She
no.
replied at 10 o'clock at night. I had the reply. You guys have been amazing, Dr. Yang, and the city is really, really lucky to have you.
Yeah.
You've filled the gap from Quincy Medical Center being gone. I don't know where the city would be if we didn't have Manet right now.
That is correct. And do not forget that Manet started by citizens in Howell's Neck who knew they needed health care. And it has grown from there, and it has truly grown incredibly under Henry Tuttle's and now Cynthia Sierra's stewardship. You are an amazing group, but you all are amazing. And I am so grateful for all of you. And thank you all for participating tonight. I hope our members and our participants realize how lucky they are to have you.
So I want to make sure Melissa has a chance. She wanted to do some wrap up and just remind everybody of some volunteer opportunities, a few other things going on. So Melissa, the floor is back to you.
Great, thank you so much. And so I'm really sorry, we had a few people put in a couple questions. We didn't, unfortunately, as you know, we didn't have enough time to really get to that. We did get through the program of questions that we put together ahead of time, so I apologize that the Q&A was not available for other questions to put in. So I do want to point out that tonight was a fundraiser, but there are other ways that as individuals people can take part in supporting Father Bills. They are still doing so. I have this open now. The screen share I'm doing is for the Father Bills specifically. Their how to help in time of coronavirus, not their general volunteer page. And they're still doing some prepared meals, bagged lunches, and other donations, but that's on a smaller individual scale and not something that we can organize as a large group to put together as we've done in the past. And I also want to do a huge thanks for everyone who put together to help support this from even behind the scenes. Again, thank you for everyone here who spoke tonight. I know we've thanked you a lot, but we also want to thank some of the behind the scenes folks. So we had Patrick Ronan and Marianne Mendez gave us some big help from Father Bills on organizing this together. I want to shout out Garrett Nichols, who works under Pat McDermott, who helped get some of Pat's stuff together, and both Mike Berry Sr. and Mike Berry Jr. For helping us get in better touch with Joe Finn and I believe Beth Ann, I believe that was Nancy Delisle, but we also have other members of the Affirmative Action and Outreach Committee who did a big help too. I'm sorry I'm leaving folks out, but I know Emily Hajar, who's helpful behind the scenes here, but also put together the great graphics that you would have seen for some of the information that we have out there. I know that Matt Goldstein likes to put a lot of information on me, but I could not do this without other people's help, and it's such a huge help. And so hopefully, and as we've been saying for things, hopefully next year in person, that we'll be able to do some more in-person work for community service in honor of Dr. Luther King. So thank you all.
Great job, Melissa. Great job. You're awesome.
Oh, and I want to put on there, I want to say this out loud because this is so important, because I also work in the healthcare sector too, is that testing for all is available at Manet Healthcare CHC
on Tuesdays
for their automated scheduling. You can go to their website. They're manetchc.org.